This is the abdominal exam. I'm going to start by palpating the abdominal fascia, looking for restrictions in the abdominal fascia. He has a restriction here near the ascending colon, so I'm going to apply a compressive force until I feel the fascia move into a position of ease, and then I will hold for 3 to 5 seconds and then release, and then I will do it again, taking the fascia further into a position of ease and then release. And to explain this to the patient, I would say that some of your abdominal pain could be caused by a tightness or restriction of the fascia covering inside your abdomen. And in order to treat you, I'm going to use a technique called myofascial release. And you'll just feel me pressing on your abdomen until I find a position where the abdomen feels more at ease, and then I'll hold it and then repeat that a few times. And so with this treatment, I'm looking for being able to palpate the abdomen and feeling like the fascia is free of restriction. Next, I'm going to treat the thoracic diaphragm with indirect myofascial release. So I'll assess the patient by wrapping my hands under the rib cage and the diaphragm, and then I will move the thorax both clockwise and counterclockwise, evaluating which way it moves more freely. And so in order to treat him, I'll move the thoracic diaphragm into its position of ease, which would be to the right because he has a left rotated thoracic diaphragm. So I move it to the right into its position of ease, would hold that for a few seconds, and then relax, and then move further into the position of ease, hold it and relax, and repeat a third time. And then I would reassess the patient by, again, moving the thoracic diaphragm both clockwise and counterclockwise, looking for more freedom of motion when I move the thoracic diaphragm to the right. And then finally, I'm going to use a technique called rib raising. And to explain this to the patient, I would say that you're going to feel me place my hands underneath your back, and I'm going to push upwards on your ribs. And this is to kind of slow down some of the input that you're getting from your nervous system that could be contributing to some of your pain or discomfort. So in order to do rib raising, I come around here and place my hands underneath the patient and make sure my anterior finger pads are pressing upwards on the ribs, and hold this for a few seconds and release, and then apply the pressure again, slowly moving down the ribs, and then I would cover this on both sides, doing the same thing from the top to the bottom of the ribs bilaterally.